A day doesn't go by that I don't think about how grateful I am to be where I am right now. I went on vacation in Prague. It was 3 in the morning. I was awoken with a very strange sensation in my body. It lasted maybe 20 seconds. Made me a little nervous, but being a nurse, I didn't want to get too crazy without having some kind of diagnostic workup. The next day was the flight home. And I didn't feel really good on the flight. I didn't feel debilitating, but I felt not right. So I drove myself to the North ER and took a CT scan, EKG, chest x-ray, and physician came in to say, good news, bad news. Let me show you the CT scan. And the dissection was pretty enormous.
An aortic dissection is where the inner lining of the aorta will tear, and this will cause blood to go in between layers. Now, in Miss J's circumstances, she had a tear that extended into the blood vessels to the head and neck, as well as down to the blood vessels into the abdomen. Her dissection was probably one of the harder ones in order to try to treat, simply because it did include going into multiple different blood vessels, and so that surgery was going to be long and complex. After Miss J was discharged from the hospital, we had begun our routine surveillance program. At 3 months, we started noticing that some of the dissections that she had to the blood vessels in her head and neck were no longer there. At 6 months, when we got our next scan, and it showed that in that descending aorta, there was an area of weakness in the wall of the aorta, and that was starting to bulge out a little bit and was sort of at risk for rupturing if it just continued to be monitored. So with that, we really promptly moved towards a second operation, in which my partner and the director of aortic surgery, Dr. Belli, had offered to help with this.
I spoke to Miss J and I told her about her high-risk operation, and that with these high-risk operations, we like to plan them meticulously, and then the day of the operation, we go and operate that plan.
It is what it is, and you just have to take a day at a time, a week at a time. And I did feel better a week at a time, so you got to go with the flow. I had no symptoms. I have no chest pain. I have no sternal pain. My cardiac meds have been reduced from 12 to 3. So I thought maybe it's time to get back on the bus, and scheduled myself for a couple trips and went to Belgium with my sister just in this past December and did pretty good. Things are back on track. I feel great. Time to get moving.